It's my feel-good breakfast show.
Welcome back. We are talking all things COVID-19 infections with Infectious Diseases Specialist Dr. Emile Reid, who will be answering your burning questions on the second wave, a brand new variant of the virus. Thank you to every individual who has sent through your questions and connected with us. We've got Anthony now joining us on the line. A very good morning, Anthony. What is your question?
Hi, good morning, Expresso team, and good morning, Dr. Reid. I just have a question regarding the immunology of the new strain, or the new variant, as you put it. Why is it that the new variant is so much more transmissible than the original COVID? Is it something to do with the immunology? Is it something to do with how it's transmitted? Has it changed to a different form of transmission? Or how does that new variant so easily transmit between younger people or people in general, I would say?
Great question.
Fantastic question, Anthony. And the easy answer is we currently don't know exactly how that happened. And currently the research is still ongoing. Remember, this new variant was only described about a week back to be a wild type. And even though we knew about it for the last 3 months, it only became a wild type recently. So what we're doing currently is to associate this variant with the clinical picture. We look at the immunology, antibody development, etc., and also the effect that this variant might have on disease progression, disease severity, as well as treatment options being available. At this point in time, the only thing we do know, also looking at the UK data, is that this variant seems to be more transmissible. And not to the same degree of, for instance, measles and chickenpox. And we look at the so-called R number, where the R number of chickenpox and measles are probably 12 to 18. When it comes to COVID-19, probably only 1.5. And what we do see is that this new variant leads to an increase in transmissibility with the R value of round about 40–50%. So it increases from 1.5 maybe to 2, which means that 2 people can be infected with every person that has the virus.
Wow. And you kind of exponentially extrapolate that.
Exactly.
You can understand the new surgeons. We've got Kinsani Onika weighing in on social media saying, good morning, Dr. Emile and beautiful presenters. Thank you for saying that. The new variant, does it only affect the younger age group or everyone? And how does it differ from the original COVID-19? And does the original still exist?
Exactly. There's probably, at this point in time, probably about 12,000 plus variants that exist.
Wow.
And remember, with every replication and every spread of the virus actually changes.
An evolution.
So there's more and more variants developing. And that's why we said we develop it into quasi-species, those species that will be around all the time, and then the wild type species, which is the dominant species. So at this point in time, the new variant seems to be the dominant species.
And sorry, go for it.
Can you get reinfected? So you had COVID, but now with this new variant, can you get reinfected with this?
Are you more susceptible or less so?
At this point in time, we don't know the answer to that. And I think only time will tell. And only further research will elaborate on whether that is the case or not.
I suppose that's the conundrum here, is that you're processing data, but you're dealing with it as it's happening, and then every time you get a handle on one variant, a new evolution breaks the surface. Are we seeing a difference in the symptoms, and are we finding, I suppose, through luck, that how we have been treating is still working? Are you preparing to treat patients in a different way? How do you kind of buffer for knowing the numbers are probably only going to increase?
At this point in time, we see exactly the same symptoms. We see exactly the same clinical pictures, and are we treating people in exactly the same manner? So nothing has changed from that point of view. I think the one thing that is concerning is the volumes of patients requiring admission to hospitals. So these volumes and these numbers of ill people are more of a concern than current treatment options and manage strategies that we have in place.
What advice would you have for everyone, watching now that's maybe fearful of the second wave that's hitting South Africa currently?
Well, I think the most important thing is for us to be content with the fact that this will be the most abnormal holiday season that we will ever have in our lifetime. And we need to take stock and not be short-sighted of what is important. People wanting to spend Christmas together with massive gatherings and congregates, it shouldn't happen. There's always going to be a Christmas next year. And if we misbehave now, we're not going to see 2021. We're not going to be able to spend 2021 with our families. So we can sacrifice this year by staying safe, masking up, sanitize, physical distancing, stay in your bubble and make sure that you don't overlap with many other bubbles in the environment. Stay safe. That is what we need to do.
And I think by now we've proven that we can recalibrate. We've dealt with it. We've made it this far. And we can still survive through what has undoubtedly been one of the biggest challenges we have all faced collectively. But I stress the word collectively because we're all in it together.
Exactly.
Doc, thank you so much. Stay safe out on the front lines and all the best of luck over this festive season. I know for you, the least of your worries is Christmas lunch at this stage. So
Exactly.
please stay safe and good luck to you and the rest of your team.
Thanks, guys.